First this morning, what's been called some prejudiced, irresponsible and sensational publicity. Words used by the Federal Health Minister to describe the way the media is handling the story of AIDS, AIDS, acquired immune deficiency syndrome. Dr. Blewett is angry that media treatment about AIDS is causing public confusion, concern and hysteria, and he's attacked the Australian Medical Association Journal for joining this sensational approach. AIDS does seem to have become public health concern number one, and like many things exported from the United States, this concern is rapidly turning into a worldwide craze. In fact, there are only 1,700 victims known throughout the world, more than 1,500 of them in America. But like Legionnaire's disease and herpes before it, hysteria over AIDS is reaching epidemic proportions. The American Congress has just voted $26 million for research into AIDS, partly because it said that the number of victims doubles every 6 months. But Rod Sharp reports from San Francisco that Andrew Small, a sufferer from the disease, is only too aware of the prejudice that AIDS victims are suffering through public ignorance.
I sort of feel with all of this hysteria and people saying you can't do this and you can't do that, and we won't associate with people with AIDS, it's like I feel like we're back in Germany and it's 1933. And it really frightens me that our rights are being taken away slowly but surely. And I wonder what's going to happen next. Are we going to be sent to camps? Are they going to create the Castro ghetto and wall us all in?
Andrew Small has AIDS. He is, as he puts it, coming to terms with his own mortality, in the knowledge that the destruction of the body's immune system takes only 2 years to kill 84% of those it strikes. But he has to cope with more than just the physical consequences of catching a fatal disease at 30. Although doctors are becoming more confident that AIDS can only be passed sexually or through the transfusion of AIDS-infected blood, he's been at least once the unnecessary victim of a kind of public paranoia. It's a fear born of bald statements like Time magazine's assertion that a majority of the experts believe what was once known as the gay plague will enter the general population. A fear for which San Francisco's medical director, Dr. Melvyn Silverman, can think of only one antidote.
Education and knowledge is the most important thing. With that knowledge, with that education, people then hopefully can make some rational, good decisions. And so we have signs that we are having distributed that basically say AIDS is everyone's problem, protect yourself, and then it lists the ways in which you can protect yourself. The strange thing, and I really don't have an answer, is that the more information we give out, factual information, the more people ignore it. And I don't understand this. We've said it time and time again, and when I say we, I'm talking about the Secretary of Health for the United States, the Assistant Secretary of Health, who's a physician, the Center for Disease Control, my office. We keep saying that it's not spread through casual contact, that it is not spread through shaking hands, through eating in a restaurant where the plates may have been handled by AIDS patients. And I think it is an irrational approach. I had a letter come in from somebody in the court system here saying their clerk wanted to know whether it was okay to accept papers from someone who had AIDS. Well, that is a hysterical reaction. It's an extreme reaction. I think in the non-gay community, you have a lot of confusion and fear, and possibly fear of being around gay males because they're afraid they're going to catch this disease, even though we state time and time again that it is not casually spread.
Hardly a day seems to pass without a fresh public alarm. Undertakers in New York have agreed they'll refuse to embalm the bodies of AIDS victims. South of San Francisco in Silicon Valley, 2 nurses resigned from their jobs rather than care for an AIDS patient. In the most outstanding example of a public body putting both feet in the AIDS controversy, San Francisco Police Department recently announced that officers would be equipped with rubber gloves and masks for handling patients with contagious diseases. Unfortunately, some people thought they would start seeing policemen in the Castro, the city's gay district, wearing gloves and masks. Last week in San Francisco, technicians at a television studio locked out a pair of AIDS sufferers who were supposed to come on a talk show the producers said would reduce AIDS hysteria. Finally, they were connected by telephone. On the same day, Andrew Small reported for jury duty.
We got down to a question of your occupation. I said, well, I'm currently disabled. The judge looked at me and asked what my disability was, and I said, I have AIDS. And she didn't say anything. She just wrote it down, and the attorneys just wrote it down. And the jury, I didn't see any reaction. Apparently, though, one of my fellow jurors told me that the woman sitting next to me visibly gasped. I went to lunch, I came back, and I was called into the judge's chambers. And it really scared me. I mean, you don't get called into judge's chambers for nothing. I thought, I haven't done anything wrong. And then my other thought was, oh no, somebody's died. And they have to, they're getting word to me that one of my friends has died, and everybody knows I'm doing jury duty this week. I walked in, but counsel for both the plaintiff and defendant were there. And that's when she told me that 6 of my fellow jurors had sent her a note, either requesting that I not serve or expressing concern over serving on a jury with a person with AIDS because they were afraid they were going to catch it from me. And I was stunned. And I was really angry. I thought, this is ridiculous. You can't catch it from just sitting next to somebody in a jury room.
Andrew Small, a victim of AIDS in San Francisco. AM time is 6 minutes past 8.